Thank you for joining News You Can Use today. My name is Carl Chappell, and I will be your host. And today's guest is Mary Morganfield and Dr. Margaret Gladden. They are with Christian Counseling Services, located here in St. Louis, or in Florissant on Dunn Road. And thank you, ladies, for being here. I think from our earlier conversations, you provide a service for the North County region that really can use it.
Absolutely.
In several different ways. Can you tell us a little bit about your
sure.
organization and how what you actually are doing?
Okay, yes. First, thank you for having us.
Yes.
We appreciate the opportunity. And we are LifeQuest Christian Counseling Services, and we serve the community by providing a professional, because we are licensed professional counselors, and we provide mental health counseling and behavioral health counseling to the community. We also provide addictions counseling for the community as well. We are a certified agency by the Missouri Department of Mental Health to provide mental health counseling. And we are a certified intensive outpatient treatment center for addictions in the area. We started in 2006, and we've been serving the community since that time.
When you start breaking down into the individual services and how you or working with families or individuals now, do you hold any form of group sessions for any type of counseling? I know that something that's always needed, for example, is just bereavement
Absolutely.
counseling. And that can take many twists and turns.
It can.
So I know it's very difficult when someone tries to go into a canned program. Sometimes it fits, sometimes it doesn't.
Sure.
Do you offer those kind of programs in bereavement? Do you do it in counseling or one-on-one?
We do. We don't have any bereavement groups currently, but we do offer bereavement counseling on an individual basis. Mary does a lot of that. We have other counselors in the office who do that as well. And so people do work well in groups because it's good to hear others who are having the same issues that you're having. It helps us to feel like we're not alone in this, and it helps bring healing to everyone in the group.
Sure.
And plus, you're doubling your work, in one setting by not having to do each person individually, but more than one is served in a 1 hour or 2 hour space of time.
All right, and so you can handle individual and couples as an example for the counseling. So I think you had said that you also provide marriage counseling services.
Yes, that's Mary's area. She does marriage counseling.
Mary, is that a little pet project?
Because I guess I've been in a marriage for 44 years come July.
Yeah.
I have a passion for other, really women. I kind of speak to the wife and the woman, the mother and the daughter. But because my husband and I went through, as any relationship, you go through a lot of different changes. And you have this storybook idea of what marriage should be, or what a relationship should be, and that's not true. You have reality shows, that's not true. So I kind of let them, an ear, we try to be an ear for them so that they can talk and not be judged. But this is to let them know that some days you're going to love your mate, You're going to be in love with them sometimes. Sometimes you're going to like them. Sometimes you might not like them. But that's okay
Yeah.
because this is all part of a good, lasting, positive relationship. Any relationship you have. So I have a passion for marriages, for women, for young women, because I want them to not have to experience, say, every little detail that I did, but make their lives a little bit better. And so we do not only marriage counseling, but we do stress management, anger management, and just relationships, because if you are able to form good, positive relationships, you can usually do it at work, with your children, with your family, with your spouse. So that's what we try to do. We try to let them know we care. And we have clients that come from all over Illinois, I think Fenton, different places, because maybe they saw us on the website or that kind of thing. And I invite them to go out there and look us up, look at my face, see if you connect, because the most important thing is the client. And so we want to be there for them.
Absolutely.
Yeah, and that is one very important thing, is
Yes.
you have to make that connection.
Yes,
You do.
Yes,
If that
yes.
connection
That's
is
where
not
it
there,
starts.
then it has a tendency for people just to close themselves out.
Sure.
And they don't express what's really bothering them.
Right, right.
And,
They won't trust
and,
you unless they've made that connection with
Yeah.
you.
and stress is a very
Yes.
hard thing
Oh,
to
absolutely.
handle. Of course, and you were mentioning anger management.
And depression, I forgot that.
yeah.
Because
Well,
how could I forget
yeah.
depression? But
Well, and I think what you see a lot of with people with anger problems have a lot of deep depression going on
Yes,
at the same
yes,
time. They
yes,
sort of go
yes,
hand in hand, and that anger just seems to be more of an outlet for that.
Right. It's just a way that
yeah.
people
Yeah.
express their emotions, which is not a good way. I mean, not
Yeah.
that anger.
Yeah.
Anger is a good thing, but it has to be expressed in the right way.
Yeah.
Yeah.
Well, it's that anger management is interesting. I once told my doctors, I went in and I says, I think it's time we're going to have to balance or change my medication a little bit. And I says, he asked me, well, why was that? And I told him, I says, well, when you stand in the middle of a parking lot calling someone an idiot,
Oh.
you know you have a problem. And his head just went down on the desk, more of a chuckle in there. So it comes in many forms.
Oh, it does.
And it
It
definitely
does.
does. Now, do you have programs or services available for teens and adolescents?
We do.
Yes.
We do.
Yeah.
We have a lot of children.
Yeah.
A lot of Mary sees. Mary's also not only just good with the marriage counseling, but she sees a lot of children, especially children who are just starting school, who are having issues in school. So,
What type of issues are you really finding with the children that you're able to help them with?
You kind
rebellious.
of be
Right.
surprised. Probably the same kind of an adult. Anger
Yeah, just
management, they stressed out,
Yeah.
they feel disrespected, they feel like their parents are not listening. I was kind of thrown into that. I don't know, Margaret never told me how I got into that. It just they seem to come. And a lot of times, because the sessions are confidential, unless they're going to hurt themselves or someone else, I tell their parents and I tell them that anything that goes on in this room stays in this room unless they tell you. We have to have written permission for any information to go out.
Right.
So I tell that to the children, and I try to know that I respect them as being human beings, whether they 5.
individual.
I mean, I had a 12-month-old parent couple brought their baby in. So they have issues, and they feel like they're not being heard, and it expresses itself in anger. They flip out in this classroom, and there are counselors available in the classroom, but mostly the counselors in schools are just to get that child back in the room and not create chaos. But I try to listen to them. What I tell them, either you can come and lay out on my sofa, and sometimes they lay on the sofa, sometimes they lay on the floor, but they're talking just to get them to talk. And they really appreciate that an adult is interested in what they're feeling and what they're saying. And so I try to make that safe place for them.
Yeah, I think you find a lot of that too. As another example is early teens, mid-teens itself, and then losing one of the parents.
Yeah.
Whole host of issues.
And that really has a tendency to throw that child off center, where they're looking for that connection with someone that is now missing. And a lot of times those directions and their choices are not very good choices.
Oh, absolutely.
Right.
So I know that counseling can help that immensely to try to get them refocused, back on track.
The teens are already going through a turbulent time, that being their stage of life. They have issues, you know, where they're finding out who they are and discovering what they like and don't like about themselves, and following peers, you know, who may not be leading in the right direction because they're finding themselves. And so to have an issue like losing a loved one thrown in the mix is really pretty traumatic, because they're already going through a traumatic period.
Yeah, and school doesn't seem to help that any. I mean, when you're looking at today's ways of communication and the way that bullying becomes a big, horrible issue that fits in there, that really does have a tendency to scar a lot of young adolescents.
We get a lot of adults, you know, who are still stuck in that age where they were bullied and where they were, you know, just made to be victims, and they're still stuck there. So we get a lot of people who are in adult bodies, but in a different place emotionally.
And adults that are bullying.
Yes, absolutely. Yes.
So, but that's one thing that I ask the children. I'm concerned about their grades, what favorite subjects, how they relate to their teachers. And I ask them, because I'm looking for bullying. How do you have friends in the classroom or at school? Tell me some of them, you know, tell me what their names, and they might go into their names. And so, are you okay? Everybody treating you okay? Are you I might come out and say bullying. And I let them know, because I don't want anything to happen to you in that classroom, as well as I don't want you to be offensive or to someone else in the classroom. So those are things that we talk about. In fact, I've had extensive training in tutoring, so I'm interested in those grades, and I'm interested in the math and the reading and those kinds of things, so that they will know that that's important, you know. And we talk about what they want to do in the future. So we talk about a lot of things, and I'm trying to build the trust with them so that they will know, like I said, and really talk.
Well, and social media can be a good thing, but it's also is that tool that has a lot of the bullying segments really that come through that. And there are just a lot of mean things on there, but it doesn't mean that social media is bad.
Oh, it's just a medium.
It's some people are using it for the wrong reasons. So earlier you had mentioned that you also do substance abuse counseling.
Yes, we do.
How does that work?
Well, we have an intensive outpatient treatment program, and this is for people who have either been just released from an inpatient program and they need continued care. And so it's pretty expensive to do inpatient. And so the state now allows for agencies to operate as outpatient, intensive outpatient. Intensive outpatient means that they have to spend so many hours per week in counseling. And so instead of being in a hospital, you do it out of the hospital, and you're able to stay in your community and work your job or be in your family without being separated from them, and then coming back into an environment where you're going to have to live what you've learned in the inpatient program. But this way, done in an outpatient setting, while they're getting their treatment, they're learning how to live in the community, and they're learning how to live with the family members. You know, in fact, the family members are part of the treatment. We give them counseling so that they can learn how to live with the person who has addiction. And so it just helps. You get a better outcome when you do it this way.
So it's done on a one-to-one basis. This isn't like an AA or
AA is part of the 10 hours,
yes,
or a program with an AA foundation. But most of it is done, the 10 hours is accomplished through group counseling. They have to come to groups 3 or 4 times a week. They have to do individual counseling at least once a week. And then that helps them to learn how to handle their addictions and learn how to know what their triggers are that would lead back to it, to prevent relapse, for relapse prevention. And so we teach them about how a person becomes an addict, and we teach them about what drugs do to your brain, what they do to your body, because we feel like when you're better informed, you are likely better able to make better choices. And so we teach them what they can expect, being free of drugs for a certain period of time, what they can expect to happen to them, so they're not surprised by it when it does happen.
Okay, well, I know there's probably people out there saying it's okay, so we're going through all this, but we haven't asked that magic question. What does this cost?
Well, the cost does vary. We do accept insurance. All the major carriers, we accept coverage for that. A lot of people don't have insurance. Then we have to look to Medicaid, if Medicaid would try to help pay for the cost of, but most times people have to do private pay, and we work out a program with them to help them to meet the cost. We do a lot of pro bono services at LifeQuest. We are a Christian organization, so we don't want anyone to be turned away or not have counseling just because they cannot afford to pay. We are limited in what we can do, but we do the best that we can. Mary does a lot of pro bono counseling.
So, and that's, that is one thing that really stops a lot of people itself,
Yes.
is they're afraid that it just costs too much
Yes.
to get out of that, and they don't realize that a lot of people, if they are covered under Medicaid, there's a lot of state programs that will
A lot of
help,
state, yes, exactly.
that help compensate
Exactly.
those types of services.
Sure. Sure.
So there's
And the
a
cost-
lot of
the
ways to
cost
get
is-
around it.
I'm sorry. The cost is greater if they don't get the help that they need.
Yeah.
So, there is help, like you are saying. That something we can help you to find that help.
What do you find as your most age group, I guess, would be for individuals that you find with addictions? You find it more
With
so with
addictions.
kids coming up with the epidemic we have going on with heroin uses, or are you seeing this in more adults between 25 and 30s, or 40, for
I
example?
think that's the biggest range. We between 25 and up into the senior citizens as well, because of the prescriptions or the meds that seniors have to take. They can be pretty easily overused or misused, and so it ends up
Yeah, I think it's one thing always to make a little bit clear in there is that when you're doing substance abuse doesn't mean just drugs that you're buying off
Yes.
the
Oh,
street.
absolutely.
Oh, I was
It
thinking
doesn't
that.
mean
Yeah.
Absolutely.
heroin, or it doesn't mean crack. It doesn't mean
Sure.
marijuana.
Oh, absolutely.
There's
Prescription
Gambling,
drugs.
shopping.
Yeah.
I usually get the women that way.
Yeah.
That keeps them from being a little
Yeah.
little less judgmental. If I said addiction could be shopping, when was the last time you went shopping? When was the last time you got a purse?
Yeah.
But
Are you able to walk through your house because you shop too much? Yeah.
so addictions, I say, is just putting a Band-Aid over the Grand Canyon. One Band-Aid won't do, so you keep going back,
Yeah.
and it really is not the answer. So it's something else. And
Yeah.
a lot of times that's what we think about: alcohol, drugs, prescription drugs. But we don't think about food, Pepsis. I just heard a lady said she had an addiction to Mountain Dew. So it's that emotional need that's not being addressed is the problem. And so addictions run in many forms that you wouldn't even going sex addictions. They're going from one man to the other, one woman to the other. You know, so it could be anything that you're trying to cover up an emotional wound with the wrong thing. So those are the kinds of things that we face. And I found that a lot of the clients that came in for one depression or stress, they had some substance abuse, some addictions. And so Margaret and I talked often about how we want to get more training. This is her passion, and that's good. It kind of forms the office, and because it reaches the needs of most of the clients. But we found that most individuals, some type of addiction is usually in there somewhere.
People try to self-medicate.
Yeah,
so they
yeah.
end up,
And it doesn't mean that it has to be chemical.
No.
Oh, absolutely,
no,
yeah.
no,
Oh, sure.
no.
Oh, sure.
Yeah,
No.
I think a lot of people just don't think about those types of
Right.
of issues when they're looking
Sure.
at you know, it's
Sure.
we're always accused of obesity, and
Yeah.
that obesity itself is due to the lifestyle and
Sure.
eating wrong, and that's probably right about 10% of the time. You know, and it's a number that I'm using is probably
Sure.
fictitious anyway, but there are so many other things that are in our daily lives and in our food supply that emotional status, people don't realize just how much emotion has to do
sure.
with,
Oh, absolutely.
with weight.
That's what drives. That's
So-
what drives.
All right, so the reason I was able to find you is we had received a flyer that you are in the process of setting up a health fair.
Right, a community health fair.
And can you tell us a little bit about that and when that's going to be?
Yes, it's a community health fair. It's our very first one, and it's going to be held May 20th, Saturday, May 20th of this year, and it's going to be at our location. And the purpose of it is to address the need in our community to understand the importance of getting checkups and to doing preventative care and then maintenance on their health care. And so it's an issue that will help people to stay on top of their health issues, might be able to identify health issues early and then not have them to progress into something more costly or more detrimental health-wise for them. So we want to educate the community, help educate the community more on the importance of getting checkups and doing preventative health care.
Will you have other agencies
Yes.
there?
We'll have other agencies who will be doing blood pressure checks and cholesterol checks, and we will also be doing handing out materials that'll help to educate, like diabetes, and education on diabetes, education on heart disease, education on breast cancer, prostate cancer. We're also going to be doing prostate screenings that day as well for men. And so it's, we have someone who's going to be representing that area of medicine, and so we're hoping to get a large crowd out. It's going to be fun. We're hoping for good weather that day so that we can have more people to participate in the fair.
Well, it's on Saturday, May 20th.
May 20th
That's
at 10
always
o'clock.
a sunshiny day.
Oh.
Okay.
And we're going to have prizes and raffles and all the good stuff that's fun, all while learning about issues that'll help us to have better health care.
Is there any cost to attending this?
No, it's no cost.
So this
to
is
the
purely an
public.
open house
It
and
is.
open attendance for people to come and just see what's going on
Right.
and see if they can find something there that can help them.
Sure, sure.
This is on Saturday, May 20th at 10 a.m. to 2 p.m.
10 to 2.
Right.
Okay. Can you give us a little insight? Have you had other organizations already contact you to
Yes,
attend?
we are talking with DePaul Hospital about providing services that day. We are talking with Dearborg, the grocery stores, to help provide raffle prizes that we can help to bring people in. You know, we're looking to have a large raffle. We don't know what that is right now, but it's going to be very nice for people to
Okay.
engage in, to win a very nice gift. And so we're the deadline for our organizations getting their intends in is the 28th of this month. And so
Okay,
hopefully
so
we'll have-
anyone that wants to
Yes.
participate, not as a spectator, but participate as an organization
Sure.
to show their provide
Right.
Now, that is
information
a
on their
cost, isn't it?
services would be
Yes.
this month, April 28th. Would
Right.
Be and where, who would they contact and
They
how
can
would they do
contact
that?
LifeQuest at 830-9970, or they can go to the website lifequest-healthfair.org.
And what is the address?
It is 203 Dunn Road.
Okay, so that's the next building east of Metro Imaging. For
Yes,
people
we're in the
that-
same complex where Metro Imaging
Okay.
is, right at the corner of Dunn and Graham Road at Highway 270.
Okay, good.
Right behind the 7-Eleven, which
Got
now
it.
is a Phillips 66,
Yeah.
but was a 7-Eleven.
Okay. Well, ladies, I really do appreciate the information that you've been able to provide. I'm sure that your health fair is going to be very well attended.
Yes, we believe so too.
We definitely need a lot of help in North County. Okay. Well, I want to thank you again, once again, for participating, and we can't wait till
Well, thank you.
May
Thank you for
20th
having
to
us.
see what's going on.
We
Okay?
appreciate it.
All right. All right, and with that, we thank you for attending, visiting with us on News You Can Use here today, and hopefully we'll see you next time. Thank you.